When you come to Danila Dilba, your doctor might give you a prescription for medicines. You can then take the prescription to a chemist or pharmacy to get the medicines the doctor talked with you about.
So the role of the pharmacist is to dispense medication to clients, to give education about the medication, to make sure that they're continuing to take their medication, to help advise doctors, nurses and Aboriginal health workers about the effects of medications and taking multiple medications and the effects that it might have on the client. Pharmacist provides med checks and home medicine reviews. With the medicine checks, they're just checking that the medications are still appropriate for the client and doing the right things in making them well. So it's important because the pharmacist is there to provide advice to make sure that your health is not being affected by your medications and that the medications are doing the right thing to help your well-being.
Danila Dilba has 4 preferred chemists. You can use any one you want, but we like to use these ones because we work closely with them to get the best care for you at the best price for you and Danila Dilba. When you go to see the pharmacist, they may ask you questions to help give you the best possible care. Some of the questions might be if you have any allergies, to make sure the medicines won't make you sick. If you're pregnant or breastfeeding, because some medicines are not safe to take if you are, and they might hurt the baby. If you're taking any other medicines, because some medicines don't mix well together. They might also ask you if you have been in hospital recently or how much your child weighs. The pharmacist can take you to a private room if you don't want other people in the shop to hear what you are talking about, or if you're ashamed to ask questions. Sometimes you might have to wait because it takes time to make up a prescription and check that it is safe. Sometimes the pharmacist will need to check with the doctor or wait for the doctor to send some information before they can give you the medicine. These are done to help protect you from harm. It's part of the pharmacist's job to explain how to take medicines. This might include how to use blister packs or sachets, and what to do if you miss a day or take the wrong day's medicine. You can always ask the pharmacist or ask to speak with the pharmacist at Danila Dilba if you are unsure about your medicines. We are happy to help. It's important for your health that you take your medicines when and how the pharmacist asks you to. If you don't, you might not get better, and you might even get sicker if you don't do it the proper way. Some medicines work better in the body if they are taken with food, but some are better with an empty stomach. Some tablets need to be taken in the morning. If they are taken at night, they can make it hard to sleep, and vice versa. If you drink alcohol with some medicines, it can make you very sick. You have to be careful how much Panadol or paracetamol you take because you can get sick from taking too much. When you buy medicines at supermarkets or corner stores, it's worth having a yarn with your doctor or pharmacist about them. For example, some pain medicines and some blood pressure tablets taken together can be very bad for the kidneys and the heart. If you are taking any regular medicines, we would like you to come to Danila Dilba for a regular checkup at least every 6 months and see if those medicines are doing their job for you. Remember, your chemist and Danila Dilba doctor, nurse or Aboriginal health practitioner can always help if you have any questions.